After observing the link between poverty and disease in Taiwan, Tzu Chi's founder, Master Cheng Yen, decided to build a hospital for the poorer east coast of the country. The hospital would promote humanitarian healthcare and respect for life. Finally, in 1986, Tzu Chi General Hospital opened in Hualien. As part of our 45th anniversary coverage, today we start a new series of features on Tzu Chi's medical mission.
On June 28, 2003, at 3:50 in the afternoon, Hualien Tzu Chi Hospital completed its first major international operation. Conjoined twins Leah and Rachel Mollett were born connected at the chest in the Philippines. Their father, who was a poor farmer earning less than $1 a day, says Tzu Chi changed the fate of his family. After over 2 months of planning, a medical team from almost 10 different departments at Hualien Tzu Chi Hospital successfully completed the 6-hour separation procedure. As well as a relay of love, the operation was a result of international medical relief. In their grassroots work, Tzu Chi volunteers saw the link between poverty and disease, which is why on September 10, 1972, a free clinic was opened on Ren Ai Street in Hualien.
Before, medical health was very bad. If you had no money, you couldn't afford to get sick.
Back then, Zhang Chengwen, Deng Suqing and other medical workers gave up their lunch breaks twice a week to volunteer at the clinic.
As soon as we got off work, we would go to the clinic and after it was over, run back to work.
The brothers wouldn't use our medicine. That medicine was all for the free clinic for the poor, so they separated it very clearly into public and private use. That was the first time I saw that.
On the insistence of Tzu Chi founder Master Cheng Yen, each patient was treated like a member of the family.
On Tuesday and Saturday, the master would always make free time to come and see and show her concern.
The master used to bag the medicine. She would come here to help bag the medicine.
Apart from the center on Ren Ai Street, sometimes volunteers would go to Taidong to hold free clinics. In 15 years, over 140,000 cases were seen. Master Cheng Yen formally announced the plan to build Tzu Chi General Hospital in 1979.
我什么都没有，我只有呢以信使成正，还有命一条。我信我自己无私，我相信人人有爱心。凭这样的信心，所以呢，我要把医院盖起来。
Back then, the Tzu Chi Foundation only had 100 commissioners, but Master Cheng Yen wanted a hospital with 500 to 600 beds that experts estimated would cost 600 to 800 million NT dollars to build.
我的目标不是干那要爱钱起病，绝对不是。我爱要净化人心。
That lofty call caught the imagination of the public, and loyal Tzu Chi commissioners went into the streets and alleyways of Taiwan to raise money to help their spiritual master build the hospital. Others took part-time jobs as cleaners, while some sold their jewelry, withdrew their life savings, and mortgaged their property. But most donors gave $5, $10 or $100 at a time. Apart from fundraising, finding an available plot of land was also a challenge. The first groundbreaking took place at the Guofu neighborhood on February 5, 1983. Volunteers spent 2 days cleaning up the land, but then a Taiwanese military project forced Tzu Chi to cancel its plan. A worried Master Cheng Yen did not sleep or eat for days. After a busy year, finally on April 24, 1984, another groundbreaking took place on Hualien's Zhongyang Road. But over each hurdle to find the funds, the land and the personnel, Tzu Chi's founder did not back down.
我决定将这个贴水池啊，这份的力量，我要往下落去掘，掘出了井水来。所以，我还是呢决定要做一个掘井的人。
August 17, 1986, Tzu Chi Hospital opened. Up until April 2011, 49 overseas medical cases helped patients from 16 countries. As Tzu Chi reaches out around the world, currently there are nearly 10,000 volunteers in 5 continents who offer free healthcare services to people in 44 countries. Tzu Chi's medical mission is a testimony of love and compassion.
To mark Tzu Chi's 45th anniversary this year, we're bringing you a series of features on the organization's missions, continuing today with an in-depth look at the medical program. Tzu Chi's hospitals around Taiwan are run on the principles of respecting life and not giving up on any patient. The large and well-equipped facilities offer complete and professional medical care, but with a very human touch. The first general hospital opened in Hualien on the east coast of Taiwan, followed by other branches in places that lacked healthcare resources. To reach out to isolated rural and mountainous areas, Tzu Chi organizes regular free mobile clinics. And of course, in the event of natural disasters, doctors, nurses and volunteers quickly form emergency medical teams to treat the victims of earthquakes, floods and landslides. But we start today's feature by meeting a road accident victim whose life was saved at Tzu Chi General Hospital.
In January 1996, Huang Xiuzhen was out riding her motorcycle when she was run over by a truck and taken to Hualien Tzu Chi Hospital.
When Xiuzhen came to the hospital, she wasn't taken to emergency, but straight to the operating theatre because her condition was very, very serious. We couldn't waste time in emergency and had to rush her to the theatre. Why? Because some of the wounds in her abdomen were still bleeding profusely and her blood pressure was almost untraceable. She was very, very anemic.
When Dr. Jian saw me, he was already wearing his surgical gown. He told me, "Xiuzhen, you're safe now, don't be afraid." After he told me that, I thought I really shouldn't be afraid and let him anesthetize me.
Xiuzhen was in hospital for 8 months and in 2 years received 17 operations. Her case is representative of all the life-saving procedures at Hualien.
每一次我若听到讲抢救一个成功啦，我真正讲哦，从内心哦，就是呐喊着感恩呐，我的弟子们呐，人间菩萨们呐，大家呢用心、用爱、用力呢，成就了医疗事业，抢救了生命。
In 1999, Hualien Yuli Hospital opened up, and the next year the Guanshan branch threw a new lifeline to the Taidong area. Soon, Daling and Jiayi, Xindian and Taipei, and Tanzi and Taichung soon had Tzu Chi hospitals. In the hospital lobbies, the mural of the Buddha caring for the sick represents the people-centered approach at Tzu Chi hospitals.
有病就是少不了医，这个医呢，他又不能来呀，医院又不在当地呀，那要怎么办呢？活动医院，这就是这个医疗事业的人文。他不能来，那就我去咯，走动医疗。
As the network expanded, points grew into lines and then full coverage as Tzu Chi's mobile clinics went into the countryside.
我们是关山慈济医院民俗民给民出民需要看病的请到卫生所今天的医师是邱医师。
After graduating from the top medical school in Taiwan, Dr. Qiu Zhaorong decided to stay in rural Guanshan to serve local indigenous people. Coming from Myanmar, as a child, she always wanted to emulate Mother Teresa.
We treat Dr. Qiu with great respect. When she comes, we are very respectful. When she's here, our drinkers always hide their bottles because she'll always scold us. She's like a protective god, a goddess of the land.
After devoting her life to the health of indigenous villagers in the Taidong area, Dr. Cho died of cancer of the liver in 2008. She donated her body to Tzu Chi University to pass on the baton to the next generation of medical students. In the aftermath of the September 21st earthquake of 1999, Hualien Tzu Chi Hospital formed a medical rescue team led by the superintendent at the time, Dr. Jian Shouxing. 12 doctors, 28 nurses went to the Taichung area to save lives. After Typhoon Morakot in 2009, the Tzu Chi Medical Mission Executive Director, Dr. Lin Junlong, led a team with Tzu Chi International Medical Association doctors into the Lingbian disaster area. Apart from disaster relief, Tzu Chi Hospital doctors and volunteers regularly give up their weekends to visit needy patients at their homes. Huang Xiuzhen says the care and treatment she received in hospital helped her make a miraculous recovery. This is what she had to say in a thank you letter to Superintendent Jian Shouxing.
Tzu Chi Hospital gave me the feeling that all the staff were very nice and helped me slowly get back on my feet again. Tzu Chi didn't just save my life, it gave me a whole lifeline, which was a feeling of great security.
The loving healthcare and patient-centered treatment at Tzu Chi hospitals helps save lives and spread the seeds of love.
We stay on the subject of Tzu Chi's hospitals in our next feature. The Foundation's medical mission has been going for 25 years, and although there are no Tzu Chi hospitals outside Taiwan, there are free clinic centres and dialysis centres in Malaysia, the United States and the Philippines. Tzu Chi also sends emergency medical teams to disaster situations around the world, and in special cases brings patients to Taiwan for complex procedures.
Sofian was born in Indonesia in 1989. When he was 7 years old, a tumour started to grow by his right eye. His parents spent all their savings on 2 operations. But the tumour continued to grow, making it impossible for him to close his eye. In his 14th year, Tzu Chi volunteers arranged for him to go to Hualien Tzu Chi Hospital for treatment. A medical team set about saving his vision and restoring his features. On May 13, 2004, doctors and nurses from 8 different departments completed a complex 21-hour procedure. But healthcare at Tzu Chi Hospital is more than just treating the patient and curing the disease.
I'm better now. Thank you, Master Cheng Yen. Thank you, doctors. Thank you, nurses. Thank you, Mommy.
Sofian came to the attention of Tzu Chi because of TIMA, the Tzu Chi International Medical Association, which in turn has its roots in the Rwandan genocide of 1994. During the crisis, Tzu Chi doctors worked on the front line in cooperation with Médecins Sans Frontières. 4 years later, in 1998, TIMA was formed. On March 27, 2006, when Indonesia was rocked by the Java earthquake, TIMA chapters in Singapore, Taiwan and Malaysia sent a 45-member team to treat the wounded. Fixing IV trips to banana trees, the doctors worked under harsh conditions and performed surgeries in an international disaster situation for the first time in TIMA's history. Following the China earthquake of May 12, 2008, 17 TIMA teams rotated in the disaster area. A local hospital was inspired to join the free clinic. After the Haiti earthquake of January 12, 2010, 73 doctors in 8 missions served 15,264 patients. Both patients and doctors were moved to tears. Apart from emergency aid, Tzu Chi also runs healthcare service points. Tzu Chi opened a dialysis center in Penang, Malaysia in 1997. Because of the rich, salty Malaysian diet, over 200,000 people out of a population of 20 million suffer kidney failure, but only 20% can afford treatment. Today, there are 3 Tzu Chi dialysis centers in Penang, Butterworth and Jitra that give patients free treatment. In 2005, Tzu Chi launched the Vision Restoration Program in China, helping over 5,000 poor cataract sufferers see again by 2010. Tima also helped blind people to see again in the Philippines. In war-torn Zamboanga in the Philippines, invalids and cripples are a common sight, but the cost of a prosthesis is what the average family would spend in 6 months. In 2004, Tima Philippines opened a prosthesis center to help poor disabled people. But pain and disease are not confined to the developing world. In 1993, Tzu Chi established a free clinic center in the United States in the first step to internationalizing its healthcare network. The first free dental clinic took place the following year, in 1994. Later, volunteer doctors used community clinics and the Tzu Chi Mobile Dental Clinic to reach out to more patients. Inventive doctors made their own portable equipment to take on the road. All over the world, expert medical volunteers have served over 160,000 cases in nearly 8,500 free clinics, helping a combined total of nearly 2 million people. Their selfless service is flying the flag for great love.
The link between poverty and sickness is well documented. To work towards ending the vicious cycle between the two, Tzu Chi launched its medical mission 25 years ago. There are now 6 Tzu Chi hospitals in Taiwan. One thing that makes them stand out from the rest is the advanced system of hospital volunteers who provide a bridge between the doctors and patients. In today's 45th anniversary report, we look back at the tradition of volunteers in Tzu Chi hospitals.
Following Typhoon Herb in 1996, Tzu Chi volunteers worked closely with Hualien Hospital in China to care for the victims, bringing to the hospital their unique brand of medical charity. It was also the first hospital in China to employ Tzu Chi's volunteer service. Following that time, Hualien Hospital, in addition to providing humanitarian training for its new doctors, now also sends medical staff to Taiwan to attend Tzu Chi training courses. The volunteers' efforts in bringing medical treatment and charity closer together has been a major stepping stone in the development of a system of local Chinese volunteers, as well as the concept of social welfare. Hospital volunteers are ubiquitous sights at any Tzu Chi hospital. The idea behind them was put forth by Master Cheng Yen in 1986 as the Hualien Tzu Chi Hospital first opened its doors. The master hoped that every patient could enjoy the care of volunteers. This was the start of Tzu Chi's volunteer service teams.
At that time, many people said that it was best not to visit hospitals, with some people even saying that before going to a hospital, you needed to check the almanac to see which day was more auspicious. The master, however, said that the hospitals were a field of blessings.
The volunteer bodhisattvas visit every corner of the hospital, spreading cheer and compassion, and acting as a bridge between the medical staff and patients. In 1991, Tzu Chi Hospitals created a field support team made up of medical personnel, social workers, and volunteers. These teams would visit families living in remote areas without medical care to provide checkups. This unique brand of medicine charity was the first of its kind in the medical world. Lin Jiawen, Deputy Director of Fortaram Hospital in Thailand, has fully embraced this brand of medical charity. Scrubbing away at a dirty toilet, he says that Tzu Chi has given him the power to serve people with all his might.
Blessings to you. I hope you find health and happiness.
Lin Jiawen went on a medical mission of hope in villages affected by the recent flooding in Thailand. Since the waters have yet to recede, Dr. Lin had no choice but to paddle to see his charges. Dr. Lin found his inspiration when he first met Tzu Chi in 2008. Originally hoping to be a monk, Dr. Lin decided to actualize his vow through his medical practice. As well, he regularly leads groups of doctors and nurses to attend Tzu Chi volunteer training. The medical community of Thailand, understanding the importance of hospital volunteers, has sent out a call for the training of caregivers and the need to spread medical resources to all corners of society. Tzu Chi's spirit of giving has also found its way into the world of medical education. In order to ensure doctors have first-class clinical competence, starting from 2006, Tzu Chi volunteers were asked to learn how to mimic a variety of ailments and illnesses in order to give doctors a chance to test their clinical skills. Building on this, in 2008, the Center of Standardized Patients was opened. In 2011, and what was a first for the medical education establishment in Taiwan, an objective structured clinical exam for new doctors based on Tzu Chi's experience was held throughout Taiwan.
Using this sort of exam, one can better understand the doctor's attitude when it comes to dealing with patients, as well as the skills that they must have when conducting clinical exams.
Tzu Chi volunteers also make the master's vow to help the sick as their own, as they give their lives to comforting those in suffering. Lin Yingju and his wife Jian Meiyue, longtime Tzu Chi members, volunteered in every corner of the Hualien Tzu Chi Hospital. After their death, their cadavers were donated to medical science. The spirit of giving can also be seen in Tzu Chi bone marrow donation drives. Helping those suffering from leukemia have a new chance at life, the efforts are also a vehicle for bringing together love. Tzu Chi's efforts in the field of medical treatment and education have brought about important changes in healthcare systems. Tzu Chi has not only successfully written a new chapter regarding the place of medical volunteers, but has also become a model for the medical community, as well as a pioneer in the field of medical education.